a huge round of applause. Professor Dr. Samiullah, President National Institute of Alternative Medicine Systems, Bangalore, President Federation of Acupuncture System of Therapy, Board, Founder Karnataka Acupuncture Association, Mentor and Research Guide to open the International University. Professor Dr. Samiullah will present on the topic Secret of Swift Head Needle Therapy for Paralysis and Pain. Please give a huge round of applause.
Thanks to Almighty and my parents and my masters and the teachers and organizers and Dr. Indrajit Singh and Dr. Lohia and Mr. Wang Sinming and Mr. Suning and Mr. Wang Pin and all the dignitaries and Sasriyakal, Assalamu Alaikum and wonderful good afternoon to all of you. So today I would like to discuss about something related to we all know there is needling to be done to treat for the numerous diseases for the day-to-day life. But whereas in here something is novel and then secret of the swift is nothing but is the rapid insertion. And further we would like to know about the various concepts integrated to the head needle therapy or the scalp therapy. Scalp therapy, we know only one modality of the treatment in the acupuncture, whereas I understand basically more than 12 different modalities of the scalp acupuncture is existing in the world. So in the perspective of that, in 1989, World Health Organization has been approved and recognized the nomenclature standards for the scalp acupuncture, which we would like to know based on the cerebral cortex of the brain and then physiological topographical concepts of the brain. At the same time, we will look into the traditional Chinese medicine and also the modern medicine. So here, please give the focus and concentration, pay the right attention, because I go the flow like a bullet train, but at the same time you cannot totally take it to your mind, but still I would like to give a lot of secrets to you, because the organizers has given the free charity way of the registration. On behalf of that, I also wanted to give you as a charity and a bonus and secrets, because you have to take as a fruit to you so that you can implement in your clinical practice. So now we would like this slides is the biggest problem for me if it is there. Without the slides, that will be awesome. Now we would like to know the foundation about because before stepping into any modality of the treatment, can I come here? Yeah, this is good. So now we would like to know when you are treating for the patients, before inserting to the needle on the scalp, please try to understand about the pathophysiology and then anatomical aspect of the central nervous system, which is regulating to the brain and the spinal cord. You look into that exactly. There are the whole head is located and it is stagnated on the one particular bone. That bone to be known as a beautifully it is the atlas and axis. So atlas is the place where the insular, you try to understand a small anatomical aspect I would like to give you later. I'll switch over to the topic. When we understand about the insular lobe, you know that this is the prosencephalon, mesencephalon, rhombencephalon, telencephalon and dencephalon, and based on this and based on the Brodmann areas, when we understand, I am giving you this, I cannot teach you here, but you try to keep it in your mind when you look at about the Brodmann areas, which is identified for the 52 different areas and locations are existing based on the topographical and functional aspect of the brain. But based on that principle, also I wanted to give you here, insular lobe is the base of the lobe, which is communicating and separating to the brain right hemisphere and left hemisphere based on the corpus callosum. So when we understand about the insular lobe, which is communicating to all the arteries in the central nervous system, this I am giving you as the key information. One is, see, you need to repeat with me so that you can keep it in your mind forever. Now here there are the few secrets of the scalp acupuncture. Now you understand about the peninsular, that is I told you is the atlas. Atlas is the place where you need to treat for the 10 cranial nerves except 2. But in this, all the cranial nerves are communicating from the top to bottom. You understand? So therefore, when you wanted to treat for the CNS problem, and here is the main focus to treat for the cranial nerves and also the cervical nerves, which is known as a, repeat with me, C1, C2, C3. Come on with me. C, loudly, keep it in your mind. C1, C2, C3. So these are the C1, C2, which is communicating to all the cranial nerves, where you need to insert the needle. I think somebody come volunteer to show that where exactly precisely the needling to be taken place. I think somebody volunteer come over here, and how do you feel about it? So now you understand about the half-tone lateral. I understand about the Huato is the neurosurgeon in China, and who invented this kind of the being a neurologist and treating for the hemiplegia related disorders. But doing this procedure, remember, monoplegia, hemiplegia, paraplegia, quadriplegia or the tetraplegia, or the hemiparesis or hemiparaparesis, all are connected to the bulbar palsy related disorders, which is connected to the facial palsy. So everything is connected to the, you understand the causative factors are the numerous reasons to cause the problem. You look at about the ischemic heart disease or ischemic stroke or the transient ischemic stroke or the hemorrhagic stroke, and many reasons causes the problem for the stroke. Now you understand about the C1, C2, C3. I'll go for the practical as well.
Mike.
Thank you. Here's my counterpart. Thank you very much. Yes. So just one tune proximal to the posterior horizontal line to treat for the hundreds of the diseases rather than going for the theoretical part. You understand one particular point is inserted, especially on the one tune posterior to the particular region is on the spine. When you treat for this one particular point, the people who are suffering for the neurological disorders or the cervical brachial syndrome or the cervical pain, you understand in 30 seconds, less than 10 seconds, the patient feels the relief if we applied greater than any this medicine, because I respect to all the medicines which is existing in the universe. At the same time, is one single point can be treatable for the hundreds of the diseases, but especially once you insert this to understand, it takes me 2 decades. So all the books has been given that 0.5 tune insertion is recommended proximal to the, but this point to be known as a Feng Fu. Feng is the wind, Fu is the viscera or the pool or the palace of the wind. You understand whatever the wind related problems are existing in our body, you understand there is another point to be called as a Fench. Fench is nothing but is the gallbladder 20. This can be treatable for the numerous diseases which is connected to the all the wind related problem. So therefore only one particular point. At the same time I told you C1, C2, C3. Now you just understand C1 is applied. Just you check with him, are you feeling more pain or very small amount of the pain? How do you feel? Not much. See, not much. The people says lie or something. This is ignorable. But however, once we activate, these are the only 3 points. That is cranial nerves. C4 vertebra you treat. That is treatable for the pharynx nerve, which is also long, one of the longest nerve, which is communicating to your internal organ. Remember, if the people are suffering for the respiratory, cardiothoracic related problem can be treatable by activating the single point, that point to be known as a C4. Remember, when C4 is half tuned lateral to the C4 vertebra. You remember there are the vertebrae are existing below the vertebra, half tuned lateral or the one pinky finger lateral. You just activate that point, will be precisely useful for the thoracic respiratory problem, the asthma, the people who are suffering for the day-to-day practice, and instantly patient feel the relief. When there is a cardiac problem is there, in that particular time can be treatable by activating the C4 point. When we understand about the C5 is communicating to the radial nerve and C6 is communicating to the medial nerve, C7 is connecting to the ulnar nerve and C8 also communicating to the ulnar nerve. You remember all the upper extremities can be treatable once we activate to the scalp acupuncture point. I will teach you that as well. But when we understand, treat for the dermatome, myotome, sclerotome, syndrome, enterotome. When you understand, this is the key for all of you. When you wanted to treat for the internal organ related disorders, that particular time it is recommended to use the dermatome and myotome. If you don't treat for the neurological disturbances, you are treating only by using the, according to the traditional Chinese medicine says that treat the yang ming, that will be useful to treat for the all the Wei syndromes. There are the two kinds of the syndromes based on the 8 principles. One to be known as a P syndromes, PI, that indicating all the painful obstructive syndromes, whereas in this Wei syndromes are nothing but is the atrophy syndromes, are kind of the compression of the muscular system, voluntary muscles are not functioning precisely. That could be reason to cause this problem. But however, first I wanted to treat, cleanse the body, cleanse the nervous system, treat for the spinal nerves. Once I activate this point, you remember that's activating to the spinal nerve. When the spinal artery and nerve get clear, then the vertebral artery get clear. When the vertebral arteries get clear, then the basilar artery gets clear. When the basilar artery gets clear, then the posterior communicating artery get clear. At the same time, the cerebral arteries, cerebellum arteries also get clear. Remember, the major cause for the paralysis or hemiplegia, that could be the reason is the middle MCA. You remember MCA, CCA, the posterior cerebral artery, anterior communicating artery or the anterior cerebral artery or the cerebellum arteries are responsible to cause this kind of the factor. Once we activate all these points, that will be the opening point in order to flow the chi, in order to flow the su, in order to flow the chin A, as Professor Loya said, is the body fluids, which is essential. Remember, this is the brain which is communicating through the ventricles of the brain, where the storage of the cerebrospinal fluid which is accumulated in the brain, that also precisely function. When the person doesn't get sound sleep, because you understand CSF is very weak और इंजन इतनी गर्म हो गई है कि CSF यानी पेट्रोल उसमें नहीं रहा. अगर इतना ज्यादा हो गया है तो डैम्पनेस इतना बढ़ गया है कि CSF शरीर में बढ़ गया है, especially the subarachnoid space, and also there is a lateral ventricle and the third ventricle, fourth ventricles में पानी जमा हो गया है. That could be the reason to cause the more atrophy. Also is the some of the reasons. I think we'll go to some other slides. So based on the, when we understand about the scalp acupuncture, I remember the traditional Chinese Qingluo and Qingfu, so which is called as especially the meridians and then collaterals. You remember each and every meridian, there is a relationship between each other. You remember the man cannot exist without the support of the female, the lungs cannot exist without the support of the large intestine. There is a communication, that to be known as a nexus, that to be known as a collateral, that to be known as a passage or pathway or the connectivity to the Zhang Fu theory. So there is a relationship between each other that also communicating, because when I wanted to tell you some of the points on this call, based on the principles of the Zhang Fu theory is the crucial. The next slide, we wanted to see some of the functions which is related to the cerebral cortex. There is the one particular place, the cerebral cortex is the prime cortex which is giving all the sensory and then motor signals. We all know the first order neuron, second and third and fourth order neurons. The peripheral nervous system gives the signal to the spinal cord and then communicating to the thalamus. From the thalamus it goes to the cerebral cortex of the brain. From there it passes the signal to the peripheral nervous system. If that signals is the proper, then everything is good. If this, the efferent nerves and then efferent nerves, when the efferent nerves is not passing precisely to the limbs, that causing the motor connectivities, the disconnectivity, that could be the reason where the plasticity of the muscles, where the spasticity of the muscles you can see. But here, based on the principles, I understand the numerous concepts based on the PubMed, based on the evidence-based applications which is existing in the world. So that to be, regulated, whatever they have given the information, based on that I understand not only TCM will support the entire thing, but of course this will going to support with the support of the modern medicine as well. Then the Broca's, which we call as a Brodmann areas are recognized. We all know that speech area 1, speech 2 area and speech 3 area is existing in the scalp acupuncture. But how is it so connected? Then I recognize that because you understand Broca's area is to be considered as a Broca's matlab bolna. Jab it is affected because of the hemiplegia is happened. Only remember, if the hemiplegia is on the right side, which causes the aphasia, when on the left side doesn't causes much problem, because you understand right side causing the hemiplegia, there is the blockage of the Broca's area. Speech related problem can be treatable by activating, there are the 3 to 4 locations. Remember, whenever I will tell you something is the novel information, when the speech disorders are there, that particular time treat for the Broca's area according to the Brodmann 44-45 numbers. When you wanted to treat for the vernix area, that to be treatable by using the 22 number. When the angular gyrus is the another reason posterior to the vernix area, that to be treatable by activating the 39 number. At the same time you wanted to treat the point to be known as in the Chinese names Lian Chuan, Shen Lian Chuan. There are the 3 points are located on the, exactly the point is located especially on this region. When there is a problem with the inguinal glossopharyngeal nerve, when there is a problem with the hypoglossal nerve, because the cranial nerve is very important, so that particular time when the people having the aphasia related disorders, we just insert the needle. So there are the 3 needles we just applied. So one tune lateral to this particular point also can be treatable. You understand? These are the points. So remember, when the right hand person, then treat for the left side. If the left hand person, treat on the right side, is the vice versa. But however, most of the people affected on the right side affected, so that particular time Broca's, vernix, angular gyrus, and then use these the points will be really helpful. If still the patient is not able to talk, that particular reason, and apply the chin chin UA, the points are located inside the tongue on the right and left side, and then do the stimulation. Broca's area. There is the Broca's area and then vernix area. You understand there are the points called as a Hanyan, Swan Lu, Swan Li, Chupin. Remember, gallbladder 4, 5, 6 and 7. These are the areas especially treatable for the motor area. Remember, so at the same time when you wanted to treat for the posterior side, the point to be known as a Shueko is the vernix area. Angular gyrus, there is the parietal tubercle. So in this way we just treat by using this particular region and give the strong stimulation. Remember, this is very, very important key. The people just apply the needle but doesn't have the effect. So how to be treatable? You remember 180 to 200 CPM. Keep it in your mind. When we wanted to do the stimulation, remember you just hold the needle and then give the sensation to these areas. So this to be given as a maximum is the 9 frequency, but the 5 frequency we can give the stimulation this particular region. You can see the vibration here, how the patient is feeling the vibration. This is the motor points. but this is the 108, nearly 200 times per minute is required. Remember, key information, you treat for the hemiplegia problem, just insert the needle, doesn't work. Until you don't do the vibration and impulses and conduction to be taken place on that particular region, अगर इतना muscles weak हो गया है कि उसमें जान ही नहीं है, जान इतना आसानी से नहीं आएगा जब तक आपका vibration नहीं कर दे. इसीलिए 200 times per minute, but I recorded in 47 seconds. I have done the vibration, that is the stimulation by manually and twirling, twisting, rotating, and these are the methods to be done. Once we do this procedure, then only it is possible. Now, if there is a problem, still the person is not speaking, apply the needle on the chin, UA, inside of the tongue, and then place this, and then place here also. And then finger, we can keep it with the gloves. We can put the finger inside, and then you do the stimulation. That will be awesome. The people can talk in one. Sir, Professor Loya said, but within fraction of seconds, how the bleeding technique will work. Wonderful, amazing. We all apply the Pai Hui, DU20 as a one is the sedative point, but that to be done as a bleeding, not to apply one particular needle. Remember, the DU20 is only placing the person who doesn't sleep nicely. So what to be done? Insert the needle that have the tranquilizing effect, that have the hypnotic and sedative effects. It's not like that. But you just do the bleeding because the excessive hot constitution in the brain, which is accumulated through the cerebrospinal fluid, then you have to dredge out. Once we do the bleeding technique, I know I got a good message. Lyopathy, I don't forget yours. Right? One is lyopathy. जब तक पेशेंट का कोऑर्डिनेशन नहीं होता, जब तक ये पेन से मरीज को नहीं मारते, तब तक वो अच्छा नहीं होता. याद रखिए, बस हम लोग वाइब्रेशन कर देंगे, स्टिमुलेशन कर देंगे. जब मरीज खुद अच्छा होना नहीं चाहता है, तो फिर हम लोग कुछ भी करो, क्योंकि वो डिपेंडेंट होना चाहता है. कुछ लोग के दिमाग में बैठ जाती है कि मेरी जिंदगी बस इतना ही है, मैंने 3 साल 5 साल 10 साल ट्रीटमेंट कर लिया, कुछ फायदा तो नहीं हुआ है, इससे क्या होगा. जब तक उसे लाते नहीं मारते, इसे इस मशीन से नहीं मारते, तब तक वो ठीक नहीं होता. कोऑर्डिनेशन भी उसका पेशेंट्स का होना चाहिए, बट एट द सेम टाइम कॉन्फिडेंस आल्सो रिक्वायर्ड. Now coming to the very crucial and important point, जैसा मैंने कहा कि हम लोग पैरालिसिस को ट्रीटमेंट करते हैं, क्या बेसिस के ऊपर. ऑल ऑफ यू एक्यूपंक्चरिस्ट, मैंने कहां से कहां को आपको कनेक्ट करना है, ये सीक्रेट बता देता हूं. जब तक आपने मेजरमेंट टेप के साथ नहीं करते, तब तक आपने सही पोजीशन को नहीं कर सकते. यू अंडरस्टैंड, देयर इज द सेंट्रल कॉर्टेक्स, cerebral cortex of the brain, which is located on the top of the vertex. The pre-central cortex and then post-central cortex, ये कहाँ पे है, इस चीज को जानेंगे. फिर उस particular area, acupuncture points are entirely different from the scalp acupuncture points. Remember, this is not the tunes, this to be considered as a centimeter, लेकिन centimeter में हमें confusion हो जाता है. So that's the reason I wanted to tell you in the tune itself. Tune is nothing but is the 23 mm proportional measurement. So now यहाँ पे हम लोग समझेंगे तो one particular area, the cerebral cortex of the brain. So उसके पीछे the post cerebral cortex of the brain, that point to be known as a, we all know, that is Pai Hui, DU20. From DU20 to connect the Chu pin. Chu pin is the gallbladder 7. You just communicate the gallbladder 7 is located 1 finger breadth anterior to the apex of the ear. So you understand, this is the gallbladder 7. You can see the image here. Yes. There is an area DU20 to gallbladder 7. There is a international standard acupuncture. This is. So now we communicate the entire line by placing the tape. Otherwise we don't get the right precise point. This point is located in the somatosensory cortex area. Remember, somatosensory cortex, which is communicating to the all the pain related conditions. याद रखिए, जब भी हमें sciatica problem हो या और कोई problem हो, scalp acupuncture is not only to treat for the hemiplegia, paraplegia. Of course, the numerous for the day-to-day clinical practice also recommended to do this procedure. The back pain is there, you understand. There is the GB20 to the gallbladder 7. Entire area can be divided into 5 segments. Upper segment and middle 2 by 5th and lower 2 by 5th. यानी उस लाइन को 5 में डिवाइड कर लो. Upper line to be known as a lower extremities. Upper line to be known as a upper 1 by 5th to be considered as a lower extremities. You remember below the navel. Below the navel, the person is having the problem of the low back pain or something, knee pain or so on, that can be treatable. When you come to the middle 2 by 5th, that to be treatable for the upper extremities. Upper extremities यहाँ से लेकर यहाँ तक याद रखिए, आपने shoulder से लेकर हाथ तक, मगर hands, fingers to be treatable for the lower portion. That to be point to be known as a, this is the area, and then you come down to the lower extremities, and of course is the lower 2 by 5th, that to be treatable for the all the head and neck related disorders. जिसको माइग्रेन हो, जिसको अगर कुछ भी तकलीफ हो चेहरे में, लेकिन आप लगाइए उस बिंदु को, उस पर्टिकुलर एरिया, नो बिंदु area, that to be treatable for all the facial paralysis, pain, not for the paralysis. Way syndrome and then P syndrome, both are different, but this area to be treatable for the P syndromes. You come to the another line, that line to be known as a C Shen Chung, that is the extra 4 point. Extra 4 to the swan loop, that is the gallbladder 6 point. Remember, extra 4 and then gallbladder 6 point. You just communicate the entire line, that to be treatable for the, you remember this, I'm giving you as the key information, that to be treatable for the motor connectivity, motor zone or the motor area. You remember there is a sensory and then motor area is the two different concepts, where the signals are not getting from the CNS to the hands and then limbs. That could be the reason. So that particular time you wanted to treat that paralysis conditions, the upper 1 by 5th to be considered as the lower extremities. पैर उठाने नहीं हो रहा है, ऐसे सिचुएशन में नीचे के पॉइंट ऊपर के हिस्से में स्ट्रॉन्ग वाइब्रेशन कितने मर्तबा करना है, वाइब्रेशन कितने मर्तबा कितने टाइम करना है, हाउ मेनी CPM, 200 CPM करना है. Then you come to the lower portion. The lower portion is the same again. That is the upper extremities and then head and neck. Remember here, when there is a problem is in the, as I told you, the broadcast area. So that to be treatable on the lower 2 by 5th region. Okay. When you come to the third line, that line to be known as a chanting. So that is the DU21. That is from there to the lower portion. So it's not that to the deeper level, but that to be considered as a, is the tremor area or the shaking area or the PD problem or the Parkinsonism disease. So this particular region, remember the basal ganglia and then substantia nigra is the very important role. So that particular time when we wanted to treat for the tremors, so that particular time it is recommended to apply on the contralateral side or the opposite side or the cross side, not on the affected side. Remember, when you wanted to treat, I'm telling you, I don't know how much time I do have, but still I wanted to tell you some final information as well along with this talk. So now you just apply on the opposite side of the affected side, then also you just apply the needling on the non-affected side. It is not affected side. If the problem is on the right side is affected, and treat for the all the on the opposite side. When the limbs are affected, use the point to be known as a Qianyu, Qianliu, Qianzhen, large intestine 15, small intestine 9, and then Sanyo 14. You just use these local points. At the same time, the deltoid anterior motor point to be known as a Pinao. That is the large intestine 14, and then Shausanli. L-I-10, according to the TCM, I told you, use all the Yang Ming meridian for this hand. At the same time, use the another Yang Ming meridian on the leg by using the anterior tibialis muscles points to be known as a Su San Li Yang Ling Chuan and Shang Chuk Su Xia Chuk Su and Thiako and then Chik Si Li Thui. And then these are the points on the stomach meridian you can use on the lower extremities, isn't it? Then we understand. Yeah. So further we wanted to see about the other areas to be known as there are the one particular area that to be treatable by using the 2 points that to be known as a Chupin Shaku. That is the gallbladder 7 and then gallbladder 8 is the connectivity. Remember, there are the only 2 areas, one single needle can be treatable for the numerous diseases which is connected to the auditory area. Auditory area, that is anything connected to the ear related problem. Once we strongly activate bilaterally, which is communicating to the balancing problem, vestibulocochlear nerve is affected, or there is a semicircular canals are affected, that particular region, this area to be treatable for the ear related problem. Then you understand is the anterior midline, there are the one particular cochlear finish, that point to be known as a shunting, that is the DU24. You just apply this particular region to be treatable for the basal ganglia according to the Yamamoto New School of Acupuncture. Then you just apply this needle to treat for the numerous diseases connected to the epilepsy, cerebrum and cerebellum disorders. When we wanted to treat for the another area to be known as a Saksu, that is the UB2 and then Michung UB3. So UB3 point is there, that particular region you insert on the downwards direction 4 centimeter to treat for the cardiothoracic conditions related to the cardiac problem, thoracic conditions as well. So when we wanted to treat another point to be known as a toe lingchi, toe means head. So that is gallbladder 15 area, that also treatable for the GIT related problem, a hepatocystic related problem. When we look at about the last area, this area to be known as a reproductive area, where the toe